Hey, good morning, Snow College. Brad Cook here. Welcome back to really our fifth town hall. Life during COVID is this may be something that we may want to do even after COVID. We're getting kind of encouraging feedback that this is actually a good venue or format to share information. And just to remind you what this is all about, because we are separate and we have some social distancing, it becomes even harder to make sure we have good communication lines for the administration and to the faculty, staff, and students. And so the intention here is for us to update you on what we know, what is the latest, and that we can also engage in a dialogue, a virtual dialogue. Just to remind you that as you have questions, please type them in, and we have staff here that will take those questions and we'll sort of put them in groups so that we might make sure we get it to the right person, but make sure that we want to cover as many questions as we possibly can. I really want to welcome our guest this morning. You might remember we had Mayor Scott on last time to talk a little bit about how the city is preparing and how they're adjusting to this new reality. But we want to introduce Alicia Beckstead, who is a nurse from Sevier County. And we welcome you, Alicia. Thank you. Tell us a little about you. Are you from Sevier?
Yes, I am. I live in Salina. I'm the Director of Nursing for Central Utah Public Health. We cover the 6 counties, so we cover Sevier, Sanpete, Wayne, Paiute, Juab, and Millard County is the areas that we cover. We have been doing a lot to prepare for this pandemic in our areas as far as the response, preparing our communities, the epidemiology side of it, and just making sure that our nurses and our communities are ready for what's to come.
Well, thank you for coming. How busy are you right now?
We've been pretty busy just in the preparation side of it. We haven't seen a lot of cases per se. We did end up helping Summit County. They got hit the hardest when Utah first began seeing cases up in Summit County. So we did help their nurses up there with some of the epidemiology side of it, the investigation. So that was kind of good for us to get started in the investigation side of it and see what that process would be like. So when it was our turn in our counties, we had a little idea of what it was going to be like. So we've kept ourselves busy in that realm, but plus we still have our regular duties that we're doing aside from preparing for this pandemic. We still have WIC that we offer, and immunizations, the other epidemiology side of it, communicable disease investigations that we do on a regular basis, and just our general things we do as public health nurses. So we stayed pretty busy.
Well, thank you so much. We thought we'd bring you on because I'm sure that there are always questions about, and we have a lot of our attendees, virtual attendees are from Sanpete, from Sevier. We probably have some staff and students from around the state. But we thought we'd have, rather than us sort of trying to interpret what we hear and read, it'd be good to have a health official. So we encourage those of you listening that you have a specific questions related to related to how we're prepared, how the hospitals are dealing with these with these questions. We've got Alicia here. I've been really interested to see that a lot of our Utah nurses are actually being assigned or even volunteering to go back to some of these hotspots, New York and etc. In fact, one of the IHC administrators, Aaron Wood, who's the hospital administrator here in Mount Pleasant, he and his wife are going to be going back to New York for 2 weeks. Sounds grueling to me.
It does, but very
12-hour days, 7 days a week. But the idea is that if not only can they provide important assistance, but we can gain a lot of information about how to handle this so that when they come back, they can be educators and to help us better be prepared, because we do know that we're behind, right? Our peak is behind their peak. So there's a lot to learn. So what we're being told right now is that Utah's peak is right around April 23rd, 24th. Is that in your planning? Is that what you're sort of preparing for?
Yeah, that's still the plan. There's been a few different studies that have came out. The University of Utah had one, and they had our peak this last weekend, which, we didn't see that peak really happen for us. So we still are planning to see if that peak hits Utah, the 23rd through 25th. Where in our rural areas, we've seen a different hit in our areas. We haven't seen as many cases. We wonder if our peak down here will be a little different than that as far as it's been in the Wasatch Front. We haven't seen a ton of cases in our areas. We've had the 6 cases in our district. So we covered, like I said, those 6 counties. We've had those 6 cases. We did confirm 2 more additional cases yesterday, so we are at 8 cases in our district, which still isn't a high number of cases. So we are still planning to see that peak and respond to it but we are wondering if, due to the ruralness of our area, if our peak is going to be a little different than what it will be in the rest of the state.
Just incidentally, one of our faculty members, our nursing faculty, are going to be going back to New York, and Becca Chappell from Richfield is going.
Oh.
And so, hey, we want to make sure whether we are okay in terms of sound. And so if you can't hear at all, you won't even know what I'm saying, but if there are any feedback or anything, let us know. We also understand that Shelley Wood and Tina Johnson will also be part of that nurse corps that's going back. And I think what's great about this is that we know that there are different peaks throughout the country. So as New York peaks, they get help from the rest of the country, and then New York nurses and doctors can also help other places such as Utah if we get overwhelmed. But how are you feeling that, there are always questions about relative to testing, right? Are there more tests becoming available? And then how are you feeling about the equipment, right? So ventilators, masks, protective equipment for the health professionals.
So as far as the way, the numbers are looking at for our state, we've been able to stay below that. They've talked about flattening the curve and keeping things from having an exponential rise. The way it's looking in Utah and how our numbers are going, we're doing well as far as ventilator status and being able to keep the hospitalized cases aren't peaking, and they're able to maintain those numbers. Those numbers have been able to they're staying at a good level, and so our hospitals are good. There's no issues with ventilators and hospital beds or anything like that. There's no issues at this point. And again, we won't, as long as we can maintain what we're doing and keeping it in that curve, Utah's expected to be able to meet the demands of those cases at this point. And that's why there's been so much emphasis on the social distancing and trying to keep that curve flattened so that we don't overwhelm our hospitals with increased numbers of patients and stuff, because we want to be able to have enough ventilators and PPEs and all of those necessary needed items to be able to care for those patients if they do need to be hospitalized. But in the numbers and what we're seeing right now, as long as they stay at the rate it's going, it's expected that we'll be able to maintain where we're at and to be able to see those cases and to take care of them.
Do you expect any directive to come out for everybody to get tested? Because if you have asymptomatic, if you're a carrier, then a test would at least be able to identify those, and then we can make sure that there's appropriate quarantine. But what is your sense about where the state will go relative to mandatory testing? If will it ever come to that?
It will all depend on the supply of it. So until recently, there hasn't been enough testing supplies to meet the demand of tests that are needed. They finally kind of caught up in that realm. So on Monday, they increased the testing criteria. So before it was just fever, shortness of breath, and cough were your symptoms that were available to be tested. Now there's 6 symptoms, and they only have to have one of those 6 symptoms, and it could just be a mild case of that. in order to be tested. So it can be fever, cough, shortness of breath, sore throat, muscle aches, and then loss of taste and smell, which is an interesting
one, isn't it?
But in investigations that we've done, and that helped us as well when we did the investigations with Summit County is, we were asking, did you have fever, cough, those main ones, but a lot of them were saying, it was so weird that I lost that sense of smell and taste. And then, because this is such a novel new virus that no one, there's so many things that are still coming out about the effects of what the side effects are and symptoms and things like that. So that was, very interesting for us as we were doing those investigations a few weeks, that was weeks ago when we did those investigations. So it's interesting to see now that's one of those main symptoms of COVID-19 can be that loss of taste and smell. So, yeah, so that's really opened it up, and they're really pushing people that are symptomatic with those 6 symptoms. They want them to be tested. They're really wanting to see how the testing numbers are low in the state of Utah right now. They have the ability of testing 5,000 a day, and they're not getting that number in to be tested. And so there really is a push. If they're symptomatic, they do want to be testing at the capacity that's available. So,
but don't rush off to get a test unless
No.
you have those.
So yeah, they want you to call, do the, there's the Intermountain. Intermountain has a number that you can call. If you go to coronavirus.utah.gov, you can find all the different places that you can do the testing. But no, they don't want you to go into the doctor to be tested. They want you to do the drive-through testing sites to be tested at.
Are the tests free?
No. So I think there's some are tests, some are that are free. I think I'm not 100% sure on which ones those are. I know they're working with individuals if they can't afford to be tested. I think most places are working with them to be able to get them tested so that everyone can be tested.
Yeah.
So
if you have insurance, it likely will be.
Yeah, insurances will pay for it. Yeah.
Well, I know you may not be able to say this, but there are some. Are there any confirmed cases in Sevier or Sanpete, or do you say, well, we just have X number within our region and leave it at that?
No, so we do. So if you go, we have I think we did it last week. All the weeks are kind of running together, but we got our website up and running we're releasing it by counties for our district. So if you go to centralutahpublichealth.org, you'll be able to see which counties have cases. And we will be updating that again today. Our press release will be going out. So we have cases in Millard, Juab, and then today we will release our cases in Sevier County.
In Sevier County. 2
cases. Okay. Yeah, so that information will go out today in the press release with any details that are available to be released. So.
And just remind us, this is inevitable, right?
It is.
And the slower they come, the better, but it is going to come. And
so that's, that's really why, as the governor has put out the social distancing, washing your hands, stay home if you're sick, all of those are why we're doing that. Before somebody becomes symptomatic, the 48 hours before they become symptomatic, they can be passing the virus. And so that is part of the reason why we're really pushing social distancing and, washing your hands, all those different things, because it is a virus that can be passed whenever you're not symptomatic. You don't even know you have it and you could be passing it. So
what is the protocol? Remind us of the protocol again, if to get tested. Again, make sure that who do we call again?
So you can use any telehealth service, but you need to, so with Intermountain, there is, I don't know how many for our areas, I know you can, in Richfield, the hospital, there's a number that you can drive up, you call, and they get screened, and then it gives them an availability to be tested there. I think Ephraim Clinic has the same thing. You have to call ahead and get that approval to be tested. You can't just go in and get tested. You have to do that approval process before you get tested. So just check with them before you go in to get tested.
Yeah, so make sure you call, you explain what you're feeling. They will make a determination then as to whether you ought to go and get tested.
Yeah, because you have to it still needs a doctor to approve the testing. You can't just get tested without a doctor's approval. So
an interesting question about we had one listener has a question about, her husband had almost all of these symptoms a year ago.
Mhm.
A loss of, it was the worst flu, cold he'd ever had, and he had lost his sense of taste and smell. Could the virus have been around a while, or
That's something they don't know.
They don't know.
They are working on the antibody testing to see if there was, for previous infections. I don't know if they'll be able to tell how long ago, those infections were, but they are working on, I know Red Cross is doing some testing. So if you go to the Red Cross website, if you've had they're wanting to test to see that antibodies, if that can help with as far as cases that are actually active. And then they're also working on some different lab testing to see if they were asymptomatic and didn't know it and had the virus. So there is testing that's going on to look at stuff like that, but I don't know how far back it could go, or
what I remember from one of my very difficult Snow College physiology classes that we talked about, it was how many strains there are of the flu.
Mm-hmm.
And so if someone was experiencing this a year ago, it could have been similar, but this one has some very specific.
Mm-hmm. Well, there are other coronavirus. Like coronavirus has been around for a long time, but not in this specific strain.
But COVID-19 is very specific.
Yeah. So it's been something that's been tested and been around. It's just been this is a different strain of it that's more aggressive, virulent, that is making a lot of people sick.
One of the questions is, do we know the cost of the test?
It varies. I've heard anywhere from 150, 200. Some aren't that much. It just varies depending on. There's a bunch of different labs that are testing and running it, so it just varies.
And is there just one kind of test? You hear about the swab going to the nasal cavity, mm-hmm. which makes me cringe.
Yes.
But is that really the only way to get tested?
That's the main test that most people are doing. They can do oral swabs or sputums. There's also a rapid test that is coming out that I know of hasn't been available yet in the state of Utah. I know they've ordered the tests, but I don't know that they've been available yet and that they're doing any of the rapid tests yet in the state of Utah. The rapid test, once that's available, they can have a result within 15 minutes. So once that's available, they're working on doing some mobile clinics, which they'll take out and offer and be able to do some on-site testing. So that's in the works, and I'm guessing from what I hear, it will be available within the next couple weeks, and they'll go out to sites and actually do on-site testing. But again, I don't know where they're at with getting those test kits in and getting that started, but it is coming.
We did have an attendee actually recommend a website. Marcy, just there we go. So it's www.testutah.com.
Mm-hmm.
What do you know about that website?
Yeah, so that's one that they're using up in the like the Wasatch Front up in Salt Lake and stuff like that. So that one gives them like as far as I know, like a scan barcode that they can use to go to testing sites. But when I asked about that for our rural areas, it's not, they can't get that test or use that barcode to get the testing done here. It's more for those bigger clinics that they can scan that barcode in and get the testing done through that it's not available in our local areas. Mm-hmm. So
have you been tested?
I haven't.
Yeah, neither have I, because there's no symptoms. So yeah. It's and I think what they're trying to do is and I wonder if that will change, because if Utah has 5,000 available a day, but only so many are getting them, they may be a little more lenient. Mm-hmm. But again, there are only so many tests, and mm-hmm. you want to make sure that there's enough. So
yeah, so I think they're going to work on hitting more high risk places and trying to get those testing done. And now that they've opened up those testing symptoms, hopefully that will bring more people in to get tested. So we'll see what that brings, and then I think they'll go from there.
What can you tell us about a vaccine? They're working on it, mm-hmm. but the timing of that?
So yeah, they're working on it. They have, I know they've done the animal testing on it. It sounds like it was really effective in that they're testing it it's in the human phase of testing now. I haven't heard how that part of it's going. There's a lot of different places that are, I think there's like 43 different manufacturers that are actually working on this vaccine. So hopefully, so I've heard anywhere from 6 months to a year of how long it will take.
But nothing immediate, is there? This is not something they can turn on a dime and.
Yeah, so hopefully, you know, and then they're working on trying to find like the antivirals that will be effective in helping decrease the severity of it. So there's a lot of things they're working on. They're doing the antibody testing to see if that would be something that would be helpful as well. So there's a lot of things out there that they're working on, trying to, you know, help. But
so a question that that's being asked is that I am a compromised person, and how can my husband find out if he has already had COVID-19 and is it safe to, and is safe to go back to work? How would you respond to that question?
if he's had it, has he been symptomatic or?
We don't know. We're not quite sure. But I guess one of the questions is, when will we know when it's going to be safe to go back to work? I think is a question we're all struggling with.
As far as whenever the governor will release everyone to go back to work. I think they're kind of waiting for that peak to happen and just kind of see if, you know, that projected peak, the April 25th, wait to see if that peak happens, if the cases increase. I think after that happens, you know, around May 1st, you know, waiting to see what the next couple weeks brings. I think that will answer a lot of questions as far as the severity of what's going to happen in Utah. I think that's kind of just time will tell.
The CDC is releasing this morning, and I know the state of Utah about a week ago released a phase open, right? So there's different phases. And I don't think anything's going to be really, I think we can plan on staying status quo right now until May 1st. I think that's what I'm hearing even here in Utah. But I am hearing that Utah has been kind of held up as a bit of a model in terms of the response that the state has taken, the social distancing, you know, closing schools when we did, you know, making decisions early on that were difficult and hard, but in the long run will pay off. Is that your sense?
Yeah, we've had a lot of great feedback on, you know, we've actually had calls to see, which we thought was interesting, like, are you guys not testing? Is that why you don't have cases? You know, like, it's been interesting to hear, you know, different takes on it. We're interested also to see, like, we've been asking around, why are our numbers low? But, you know, and we've reached out with different doctors' offices, different hospitals, you know, things like that to see, you know, kind of what their thoughts are on it as well in our local areas down here. And I think we're all kind of in the same thought process. There's not a lot of people that are coming in that are actually sick, either seeking testing at this point. They're still having a low number of people that are seeking that testing. So either our social distancing is really working and people have done what they're supposed to do, which it seems like they have. You know, we really have been impressed with the response that people have had with social distancing. People have taken it seriously for the most part. You know, they've stayed home. They've, you know, done what they can to try to stop the spread in our little local communities, and it's been good to see. So whether it's partly that, maybe part of it is that we haven't seen that exposure to our areas yet. We're waiting to see the next couple weeks if that's what it is. It's kind of, we're just waiting to see what's going to happen and where it's going to go in the next couple weeks in our area.
Just to remind those that might have joined us a little bit later, this is Alicia Beckstead, from a nurse from Sevier County, from Salina. But you also have do you have a larger sort of central Utah role? Remind us your role other than being a nurse.
So I'm the director of nursing for the 6 counties.
The director of nursing for 6 counties.
Yeah.
Okay. Well, good. Well, listen, we you know, those that have questions, keep them coming. Alicia, stay with us. There'll be some questions related to the campus. Probably have some students and faculty and staff that might have some questions. And as those questions come, I'm going to kind of get them positioned. We have on line with us virtually Steve Hood, who's our provost here at Snow College, Terry Clausen, who is our associate vice president for enrollment management, Josh Hales, who's our director of human resources, and Carson Howell, who is our vice president for finance administration. So just remember, those that are tuning in, if there are questions that you relate to human resources, related to academics, our planning, when it comes to enrollment next year, questions that you might have relative to where we are with the state budget, please bring those questions to us. So there was a question about, again, I know someone who doesn't have insurance and doesn't have a lot of money, but they need to talk to someone. Do you want to sort of reiterate your thought about that? I mean, I think the facilities and clinics are really good at working with people who might not have insurance or be a little strapped on that front.
Yeah, so I've reached out to our local clinics, and they are working with individuals that don't have insurance to be able to get them tested. And through our state lab, we can do the testing, but as far as the visits with the doctor and getting that referral for testing, the clinics are working with individuals so that they can get the testing done. They really don't want to turn people away if testing is necessary. So they've all been willing to work with individuals to be able to get testing done.
Yeah. So the governor did come out a day or two ago extending closures of schools to the end of the year. So that, so there is I think a good question saying, does that suggest though that the May 1 is going to be extended? And you might have a take on my take on it is that a lot of this is going to be phased. I think May 1 they might sort of take a look at what key industries might be able to re-engage safely. And I think what they've determined, at least for schools, that's just an unnecessary risk of bringing kids back. That'll be a further sort of a stage down the way there. But I think the phases are they're going to start looking at ways that they can safely restart the economy. So looking at very specific industries to start and re-engaging, but be very slow. There is the worry that there could be a resurgence later, because if we open up too quickly, I think the worry is that then there's infections will sort of spike again. What is your sense about what are you hearing from in the health sector of these phases that the governor might be?
Yeah, so that's actually what they're working on right now is it wouldn't just be, like you said, they wouldn't just open everything up and just let everyone start congregating back together. It would be slowly phasing things in. They would look at restaurants, hair salon, like all the different businesses that have been put on restrictions, closed. They would work on those, slowly reopening things to get those back in business. And I don't think that would be just opening it right back up and letting businesses completely, that kind of stuff, but it will be phasing those. I don't know if it would be limiting how many came in to start, different things like that, but that's the process that they're working on right now, is what that would look like and how, what would be the first things that would start to open up, and how that, as far as would they, what proper precautions would need to be taken if they do start opening businesses, and how could we still get the economics going and still can try to limit the spread of the disease. So that's kind of what they're working on now, is what could we do to get our economy going again, but still maintain the numbers we're at and not spread the disease.
And so of course people specific to this audience is, what does it mean for Snow College? And what does it mean in terms of when we might restart? And we're gonna give you a little bit of a break. Stay here though with us. Alicia Beckstead is the Director of Nursing for our 6 County region. But I'm gonna bring in Josh Hales at the moment. And Josh, the question that we're asking to address is, what does this mean for Snow College and our return? Let me just sort of say, as you kind of put your thoughts together, we have decided, as you know, that all instruction will happen online through the summer. So the faculty and the academic offerings will will continue through the summer. We're hoping that we're going to be back ready to go for regular face-to-face classes back in late August as we begin fall semester. What would you say, though, for Josh, the sort of non-academic folks, our staff? We may also be wanting to look at perhaps a phased approach as things get a little bit safer. Again, identifying certain types of areas that we could safely. My guess is, though, for some time we're going to be practicing social distancing. I think when we are in crowds, make sure you've got masks. So what would you say? Any thoughts there, Josh, as to how we might ease back into normalcy?
Yeah, I would say, everything I'm reading on this is, even when things are a lot safer, we really need to be careful not to rush this too much. And so I would say, at least until fall semester, if working from home is working for you, let's just keep it up as much as we can. Maybe we'll start staggering a little bit more for people coming in. But the biggest thing is we really need to be careful not to rush it. Just because the governor may come out 1st of May and say, the stay home, stay safe may be over. Let's not all rush back and I'll be on campus again, May 2nd, if that happens. Let's continue to be careful as much as we can. If you are coming on campus, wear a mask, wipe down surfaces, as you leave, those kind of things. The last thing we want is to think we beat it and then all of a sudden have a second wave. So again, let's as things become safer, we'll kind of slowly get things back to normal, but as much as possible, let's not rush it.
Thanks, Josh. So there is no May 1st deadline for employees to return. That is not what we're saying at all. And we're going to continue to sort of update our website. Remember, we've got our website on coronavirus, the FAQs there. Please check that regularly. We'll have these town halls every week to kind of update you where we are. We wish we had all the answers, but there's just so many things that we don't know as this thing evolves. We can watch what other states and other institutions are doing. I do want to tell the group, though, that the college is doing well. We're doing fine given the circumstances. We're doing fine financially. Our projections for next year look okay. There may be some questions that we'll bring in Carson Howell about the budget, and so you might know that we've just received word. We coordinate very heavily with the other presidents in the system and our commissioner, who are also staying very close to our legislature. We've been asked to just hold on spending, and that the new money that was earmarked for higher education, they're asking that campuses not spend that until later on in the fall, just to make sure that the state has the resources to cover what the federal government doesn't provide. And by the way, the federal government has stepped in to for Snow College. About $1.2 million has been allocated primarily and almost exclusively for student help. Those students that are struggling, those students that that need assistance, the federal government has kind of stepped in. So that's very reassuring. But the state isn't quite sure, what this will mean for their obligation. With unemployment being like it is, and this business, industry slowing down. But just know that we are really putting a soft freeze, again, a freeze on any new hires. We're moving forward on replacement hires, though. Those that we already have budgeted for in last year's budget, we'll move forward on that. But for new hires, we're going to be moving very, very slowly. So just know that we're not really going to be able to move on a lot of the new initiatives. Sadly, this makes me very sad that a lot of the new initiatives we're moving on are going to be a little slower. But one of the questions that people might be worried about, Josh, is what about part-time? In terms of any layoffs, with the budget delays. Before you answer, I do want to say that the college wants to make sure that we keep people employed as much as we can. We really think that's part of our obligation is to relieve during a very stressful time to make sure that people have paychecks. And we're going to work very hard for that, and there's no reason why we can't continue to do that. We want to make sure that people are productive, though we know that it's not just if you're working from home and it's very difficult to do what you're doing. Let us know so we can maybe give you some assignments that would help kind of round out your day and that sort of thing. But I think one of the worries is about part-time. So full-time, right now, there are no worries. What about part-time staff? And then, of course, with student staff, that's a little different because they would have ended at the end of this month anyway, given that they would have gone home. So do you want to just maybe update the campus on where we are with that?
Yeah, good question. So as far as all of our part-time hourly employees, no one has been laid off, and we don't have any plans to lay any of them off. And so if you're in that position and you're thinking, gosh, my office doesn't have work for me, or my manager told me not to come in because I don't have work, contact Linda Llewellyn, and she's finding other work for everybody. So there's plenty of other initiatives going on. Jason Springer has people calling students to check in and make sure that they're getting the support that they need. We have lots of extra cleaning going on both campuses. The theater department, Gina Love has a little bit of work as well, and so we're finding lots of things that were either back burner projects or things that we have to do extra because of COVID-19. There's lots of work, so reach out to Linda if your particular office has slowed down to the point where you don't need the same part-time help that you had before.
Well, we have we're talking about maybe finances. Let's bring Carson Howell in on the conversation. Carson, welcome this morning. So as you speak to your counterparts around the state, these are your colleagues that are vice presidents for business and administration. What are the latest conversations there that you can share with us?
Yeah, so there's a lot of question about what this special session means and budgets moving forward. As you mentioned, President, there's a slight holdback in some of the funds, but it's just temporary. That's due to the delay in the tax deadline. And so the legislature is looking to just delay the last disbursement of funds. And so while that will have a short-term impact, we don't expect it to be a large impact at all. We've got the funds to be able to cover that for that period of time. And so that's a lot of the questions, I think, from the other financial VPs are just, what does this mean long term? What are we looking at? And how may the budget look in the future? That we really don't know. There are a few things that we're just kind of waiting on. I think, as you mentioned, a lot of the questions regarding funding for next year and initiatives they've asked us to put on hold. And so we're looking at revisiting those and making those decisions probably later in the fall around the October timeline.
Good. Well, thank you. Appreciate that. Any other thoughts, Carson, while we've got you on some of the issues that you're dealing with from your staff, or some of the questions that you are handling that might be useful for our attendees today?
Yeah, so I think one of the big questions that we're hearing is what is going to happen with summer programs and things on campus, scheduled events on campus. We are now looking at not scheduling anything on campus until the end of May. So through May 31st, there wouldn't be anything on campus that we would be scheduling. But we're going to be reviewing that every 2 months or every 2 weeks to look and see when we can start scheduling those activities. So I know that some of the summer activities that may push off those summer activities or delay them or cancel them. So we're looking at all of those things as well. Just kind of what can be done. I think a lot of the questions that have been talked about today of when are we going to open, when are we going to get back to normal, including those summer activities and events on campus. But also I think that there have been some good things that have happened. You know, a couple of the departments have really stepped up and done a good job. And just to shout out to some of those right now, the facilities crew in doing the enhanced cleaning, I think has done a remarkable job. And being able to go out there and make sure that our campus is safe. There are some people that need to come in and do work on campus. And so to make sure that they've got a safe environment for that. Another one is the IT department. We've got, you know, this transition to online learning really hit our learning management system and Canvas pretty hard. But there's a lot of the back end things that need to work in order for that to happen. And this town hall today, IT has really stepped up to take that to the next level. And so there are some good things that are happening across campus that I think we should be proud of in response to this emergency. There's another question that has been on a lot of people's minds about raises. As you know, this last legislative session, the legislature passed a 2.5% increase for state employees. We don't know what's going to happen with that. And in fact, we've been told to wait on a decision for those. The last thing that we would want to do is make a long-term commitment that then the school doesn't have money to fund. And so that will be one of those things that we look at in the fall. Now, the nice thing is then if they make the decision and we receive those funds, those kind of decisions could be made retroactive back to the July 1st timeline. So some of those things that I think people are wondering about, those are questions that we're seeing all across the system, the USHE system.
I think the state needs to be very careful, I think, from that they don't seem tone deaf, that they're giving state employees 2.5% salary raises at a time when unemployment is at an all-time high. It just would seem the optics be very difficult, and I think we're very lucky, right, here to be at Snow College, to have work and benefits, but a lot of our friends, neighbors, loved ones don't. So it seems like that's a small sacrifice that we could make to have this deferred until fall, but it's not great news. I know we get that. Well, listen, there are a lot of great stories here. You know, one that needs I think a real specific shout out is Chase Mitchell. Chase has worked very hard working with our faculty to get up and going, and maybe this is a good transition to Steve Hood, our provost. Steve, welcome. It's nice to see you over the camera here. Do you want to give us a bit of an update on where we are on the academic enterprise as we kind of move through getting closer to the end of the semester? There's a lot that we're learning. You know, it's a bit of a crash course in lots of ways, but we have terrifically dedicated faculty that are working very hard to meet the needs of our students. But what more can you say about that to possibly faculty out there or even students that might have questions?
Yeah, we're heading into the last week and a half of classes here, and What we want to do is just encourage the students to continue to move forward. We do recognize this is an unusual situation, but you're going to get through it, and we've got faculty and we've got staff members that want to help you out. The President mentioned Chase Mitchell. Students may not know that Chase has been the guy behind the scenes that's tried to help get all of our broadcasting worked out, and it's really difficult with limited resources that the institutions have right now. Grateful to Mike Daniels in our concurrent enrollment that's been helping reach out to all of our high school partners. Kathy Bill, who's been helping out also in terms of reaching out to all of our high school partners as well. I hope students will keep working hard. Many of our science faculty put in just hours and hours of work trying to get the labs together. Our music teachers that are teaching private music lessons via Skype and so on, that is not easy, but they're moving forward on that. So grateful to all of our tech ed shop professors that have their shops divided into quadrants and so on, so they can keep as much safety as possible as they work with individual students. And we want you to finish strong. You got a week and a half to go on classes. Finish strong. It'll help you out so much. As we start heading into the summer, we have the question still about what to do about CNA courses and what to do about our cosmetology and barbering courses. And we're doing the best we can there. Our cosmetology and barbering instructors are thinking through the best way to work with that and to put the best foot forward. And so they're looking at all kinds of options. CNA courses will move forward, but at the same time, they don't want to endanger anybody. And so there may be some different change-ups in how we do some of those things. One of the things that I'm really grateful for is a lot of faculty members are thinking about innovations of moving forward. What kinds of things, if we have to do this again beyond summer, if we have to offer classes online and remotely like we've been doing, they've been thinking about innovations, things that would be more engaging for students, things that they could do better. So they're learning from this as well. So really grateful to them. But President, I'm just really amazed that so many people have worked so hard and have put their effort into trying to help people out, and especially our students. And so I'm grateful for the time they've put in, the extra effort, and some of these people are experimenting with things late into the night to try to find out if there's a better way at delivery. So really grateful to that.
Well, listen, a lot of questions still surround commencement, and so maybe this is a good time to talk about that. And as you know, we've put out a survey to all of our graduates to give them have them give us feedback as to what other options. Sadly, May 2nd and May 1st were our commencement schedules. May 1st in Richfield, May 2nd here in Ephraim, and those are no longer going to happen. And it's heartbreaking. This is a time when we celebrate the successes of our students. But we thought we'd put the question to our graduates as to what they might prefer as alternative commencements. So some of the options that we put out there would be a virtual commencement. That did not really go well. We asked them whether they might want to come back for a postponed face-to-face commencement when it got to be safe. And a lot of students felt that they probably would not come back. So with all of the data that we have, here's what we've decided to do. We are in May, we will send out a virtual message to all of our graduates. We will then send out a care package to our graduates with their diploma, tassels. We'll actually have some gifts for them. But then we'll offer a couple of events that students can come back to celebrate with us. We've identified October 9th and 10th to be our homecoming. And so students will be invited to come back to celebrate homecoming with us. But those that want a proper and regular commencement experience where they can walk across the stage, they'll be invited back next spring, and we'll have a special event for them with our 2021 graduates as well. We feel that this is in concert, and that it correlates well with the feedback that we've gotten from our students. But many of our students felt that once they leave, it would be very difficult for them to come back in August or September. And the truth is, we're not sure that a face-to-face commencement can actually happen in August anyway. We're still trying to determine the behavior of this virus. So, but we are right now, as of now, October 9th and 10th, we'll have a homecoming. We come back and have a celebration. But for a proper commencement experience, we'll have that in next spring, and that seemed to be a good option for many of our students. So one of the questions maybe want to remind us, Provost Hood, is about the pass-fail option, and what are our students' options relative to that?
So students have the opportunity to take a pass, if they would prefer, to a letter grade. And you can get information from that either by going to the COVID page on our website, or you can go directly to the registrar's office page, and there is a little tab there that says COVID-19 pass-fail option that you can take that. One thing I do want to mention about the pass-fail: if my son or daughter were in college and they had the choice of taking a pass or a B in a course, I would have them take the B. I think it looks stronger on a transcript, and even though you may have been a straight A student and so on, I mean, there may be exceptions. It could be that you have scholarship worries or whatever, and if that's the case, do talk to the scholarship office. But for the most part, I would take the letter grade. The pass-fail option is an option. We want it there for students because of the unusual circumstances, but I would think very carefully about when and how you're going to change a letter grade to a pass or a fail option.
Remind students that if they do take the pass-fail option, how does that affect GPA?
Right now, if you take a pass option, it does not figure into your GPA. It is just it is not something that goes into your regular GPA. So the GPA that you had at the end of the fall semester, if you were to take passes in all of your courses, would be the same as it is in the spring semester. It's just that you would have pass courses. However, if you're a college athlete, a pass in a course automatically is computed as a C-, and that's one of the reasons why we want to warn you about that. In addition, if you transfer to some of the other state schools, some of the programs, let's say you want to go into a top flight journalism program, and that journalism program is competitive to get into. One of the things that ends up happening is that even though they will accept the pass credit, if it's competitive to get into that program, they're going to look at the grade point averages overall. And that's why I say that a B in some cases may be a lot better for getting into a program than a pass might. So just some options to consider. And as you go to the registrar's office's webpage and you pull up that form, it'll tell you what all of these little reminders are that can help you as you determine whether or not the pass-fail option is good for you.
Well, thank you, Provost Hood. Really appreciate your work, your staff, but particularly the faculty that are working so hard in the very different modality. Thank you, faculty. Thank you to staff who are also going through major adjustment periods. And one thing that I remember a coach said to me once, that adversity has a way of introducing you to yourself. And I think that's an important message here, that this is a time of adversity, is a bit of a challenge, but but we are not people with brittle spirits. We are not people that have fragile spirits here. This is not how this campus was created. It's not how it was sustained through very difficult times. This is not even the very worst time that Snow College has faced. There are many, many more difficult situations where the campus has weathered this and weathered it well, and we will too. This is a time of creativity, possible creativity and innovation for the campus and renewal. And so support each other, but also support yourself. Remember to self-care. We are so happy that we are a team here at Snow College, and I just really appreciate it. And one really extraordinary team member that I want to highlight is Terry Clausen and her team as we prepare for enrollment and enrollment kind of questions about how students will respond during a recession that we're inevitably going through for some time, maybe even a depression. People are predicting. But I really want to highlight Terry and her team and really working hard, making sure that we're continue to connect with our potential incoming students. So Terry, welcome this morning. And there are some questions related to enrollment that we probably need to have you address, but any sort of, any sort of initial thoughts that you'd like to share with the group?
Yeah, sure. So, as the president was saying, we just are not 100% certain what this is going to look like. This is unprecedented times. So I'm really excited though, because we do have a great team in place that is doing everything that they can to make sure that we are helping our students through this enrollment process. I will say with the announcement yesterday of K-12 schools being closed until the end of the school year, and virtual learning to continue, that's definitely kind of put a wrinkle in things for us. Our seniors are going through a grieving process right now, and I think that we need to recognize that. They're missing out on some really life-altering experiences, and they're just not in a great headspace right now. So I think as we move forward across the board, as we talk to these students, we need to be aware of that. And we have to also look at how we can communicate with them and let them know that we're here for them and that it's okay to start looking towards the future. We're a really great place for these students, and we need to let them know that we're there for them and we've got their backs.
Yeah. How's enrollment looking at this point?
So we are right on par where we were last year. And what I really want to emphasize is that is extremely good for the situation that we're in. Talking to people from around the country, some of my colleagues around the state, some people are seeing double-digit declines. So more than 10% declines in their enrollment so far. People are wringing their hands. They're just not quite sure what they're doing. And we're pretty much even in par from where we were last year. So I'm really thrilled with that. We were on track to see an increase in enrollment, but this has really, it's paused, and it's caused us to not climb and grow as we were hoping. So I'm really happy that we're at least staying steady with last year.
Yeah. Do you want to remind us about, we've also extended deadlines for scholarships. We're also waiving the ACT, SAT requirements. And we also have a lot more financial aid for students than we would have. The federal government has now provided a lot more assistance. Do you want to talk about those elements, and then maybe spend a little time on if students do need financial help, that they could get help through the federal government, through us? Who do they contact? How do they get some assistance?
Yeah, absolutely. So we have extended our scholarship deadline for academic scholarships to June 1st. So if there are students out there that are looking for a place to come this fall and they qualify for academic scholarships, we want to be there for them and give them those opportunities. And then, yes, we also announced that we are test optional now for the ACT, SAT for admissions purposes, which is awesome. And if you've seen any of the national news coverage, we were ahead of the game because there's a lot of schools out there that are just making that announcement, although it's temporary for them just for this upcoming cycle. So as far as the CARES Act that was passed to give us some aid for students, I believe we have about $1.2 million that is allocated for student use that will go through our financial aid office. I've been in communication with Jack Delane, who's our financial aid director, and we're still working through some of those nuances to figure out how that can be dispersed to students. We have a webinar on Friday where we should get some more guidance as to how to do that. But from what we can tell, it's any related expenses due to COVID-19, and it is not going to be allocated only for students who qualify for Pell. So it should open up the aperture. So if we've got students who may not have filled out the FAFSA, we can still help them through this. So that's one of the things that we've recently learned, and it's just a matter of trying to figure out how to do this to get that to students.
Yeah. Yeah, well, the questions of deferring the deadline for academic scholarships is now June 1st. And there is a question about, does that same deferral extend to need-based? And your answer, given the fact that that money may be available for distribution as early as next week, my guess is that's kind of a rolling thing, right? That as students have need, or what would you say for students that are looking for need-based scholarships or need-based aid? What can you say about any deadline extensions?
So one of the things, if they are in need of aid, I would really encourage them to contact the financial aid office and the scholarship office, because there are things that we can do. For some of our private scholarships, the deadline has passed and we've already been awarding those and notifying students. And so there might be something else that a student would qualify for that isn't necessarily out there on the website. So I would just really encourage them to talk to our financial aid folks, talk to our scholarship. All their phones are forwarded to cell phones, so they are picking up and answering phones as much as possible. We do have one person in the office each day to field some of those questions. So they're there to answer your questions. So please reach out to them and they can help you through those different steps.
So a question is that if they don't have their ACT, SAT scores, how do we place them then, appropriately place them in, say, math and English if we aren't going to, that was a question that came up.
Yeah, absolutely. That was a concern. And what was decided was the fact that we've got these great placement methods, the ALEX test, and the English department has a placement for them. One thing I do want to reiterate is that this is going to be a very small percentage of students that are going to take advantage of that. Utah is an ACT state. We take this, every Utah student takes it their junior year. So the majority of our students do already come in with ACT scores. So it's very easy to place them into math and English. But for those that don't, we do have methods in place to do that for them.
Good. Well, one question is this, that since we have a bit of time in our hands, says this person, as faculty or staff, is there anything that they can do to help pursue prospective students who are still undecided, or perhaps departmentally, divisionally, or by majors? It's a good question.
Mm-hmm. That is a really great question. And we are very open to having help. We do like to centralize it because we do have what we call a CRM, a customer relation management software that we send things out of so that we can track our interactions with students. But I would be very open if people want to, write a letter to students, or if they're willing to text a list of students, we can get that information to them or make calls to encourage them. We have several things like our registration survey that we want to push students to so that we can get them registered for classes. And we're open to that, and you just need to reach out to me.
The question is, the English placement test online?
That I am
Maybe
not
maybe
100%
maybe the
sure
provost
of. That
can
might be
tell us. Steve, what is
that might be a Steve.
To tell you the truth, I don't know about that one either. Let me do some checking here.
Well, good, Terry. Well, listen, thank you so much. Please extend our thanks to your staff that are working really hard to maintain. One of the things that we're hoping is really that people continue to push whatever social media avenues they have individually to get the Snow College name out there. So stories, pictures, anything that you can do to kind of keep Snow College on the mind of prospective students and their parents, I think would be terrific. We also would like to ask that faculty and staff that would be willing, that we could actually take some photos of you in action. We're trying to put together this for Alumni Magazine and for social media to show how innovative and nimble, right, our faculty and staff have been in trying to keep a very high quality academic experience here. And so we'd love to be able to just show you in action, whether you're lecturing over online or whether you have a lab that you'd like us to highlight. Contact me personally, brad.cook@snow.edu, and then we can get photographers there, and we'd love to highlight the hard work that you're doing. Well, we're after the hour. I just wanted to make sure that we thank Alicia Beckstead, who is the Director of Nursing for our 6-county region. Any final thoughts? Any words of wisdom, advice that you might have for our group?
Excuse me, sorry. It sounds like you guys are doing just a great job with your staff, your students, and all of the measures that you've taken to keep everyone safe. I know there's lots of worries that how long is this going to last, and what does the future hold? And unfortunately, we don't have that answer for everyone. The ultimate goal here is to decrease the amount of deaths and severe illness as we can, and so ultimately that's our goal with the measures that are being taken. I know it seems extreme, and I think it's hard in our areas because we don't have a lot of numbers. We aren't seeing a lot of cases down here. But I would like to think part of it is that everyone's being so vigilant and social distancing and taking the proper precautions to stop the spread in our areas. And so we'd like to just encourage everyone to keep doing that, and hopefully we can get back to a normal routine soon, and everyone can get back to their normal life. So yeah, we're hopeful that will happen soon.
Well, thank you so much for your willingness to come and share with us what you know. Just so that you know, we're going to be trying we'll have a guest each week, and we'll try and focus on whether it's a health professional or whether it's maybe a public official of some kind. We may have some higher ed specialists. We may even have highlight one of our faculty members to talk about what they've learned. I mean, if nothing else, a college is really a place that we're learning, and we are always learning. And so we ought to be able to be self-reflective about the mistakes we may have made so that we can learn from that. So if there are suggestions of people you'd like to hear from, we could try and get everybody from the lieutenant governor to our higher education officials, some board of regents, other kind of health officials, if you think that that would be helpful. I guess as we're winding down here, let's make this the last couple of questions. One is, will recycling come back? And maybe I could pitch that to Carson. Have you thought about recycling and where that might come back in our phased approach?
Yeah, so we're looking at recycling. As you know, right now it's temporarily closed. But once I think we get through this, we'll be reevaluating. Unfortunately, the market, it actually costs us a lot of money to recycle. And so there's also a budget decision that needs to be made. And so we'll be looking at that moving forward. But those discussions will be after things kind of come back.
Great. We also want to remind you that as you stay physically safe, as you wash your hands, as you practice social distancing, and especially if you're going to crowded places like Walmart or shopping, make sure you have a mask. But also remember to stay cyber safe. We're all spending a lot more time on our devices because that's how we're working now. But make sure that you're being very cautious about opening sketchy attachments and all of that. So let us know, especially if you've got some sketchy things coming, that Paul 2 is again ever ready to help walk us through, or even of our IT team, about things. We also want to remind students that if you receive an email entitled EverFi, that is legitimate. The EverFi email is a training for mental health for our students, so it can be very helpful at this time. EverFi does sound like it would be a bit of a red flag, but in this case, the EverFi, EverFi, that is a legitimate website that you want to actually, as students, will help you as you deal with some of the emotional and mental challenges that might be inherent in a difficult time like this. Well, listen, I think it's probably important that we wind down. Thank you so much. Listen, take courage, everybody. We are a hardy people, and we come from hardy stock, and this thing isn't going to get us down. It's it'll be a bit of a speed bump, but that is all that it'll be. We have a terrific team committed to your success and to your well-being. Please keep the questions coming. We'll be back here next week at Wednesday at 10 o'clock. But continue to check our website, especially if you are coming late to this. We've made some announcements relative to commencement. We'll get some that message across in other ways as well. Please also remind us how we can do better. We are only as good as you that we're serving you in making sure you have good information, as good of information as we have it, and that's not always perfectly clear just because of the dynamic nature of the situation. But you are appreciated. You are. We admire you that you're holding up as well as you are. Take care of your families. Take care of yourself. Make sure you're getting rest. Make sure you're getting some fresh air, getting some exercise. And remember that we are not people with fragile spirits. So thank you very much. Keep safe, and until next week. Thanks.